Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question. 1. Which of the following symptoms usually signifies rapid expansion and impending rupture of an abdominal aortic aneurysm? A. Abdominal pain. B. Absent pedal pulses. C. Angina. D. Lower back pain. The answer is lower back pain. 2. What is the definitive test used to diagnose an abdominal aortic aneurysm? A. Abdominal X-ray. B. Arteriogram. C. CT scan. D. Ultrasound. The answer is arteriogram. 3. Which of the following complications is of greatest concern when caring for a preoperative abdominal aneurysm client? A. HPN. B. Aneurysm rupture. C. Cardiac arrhythmias. D. Diminished pedal pulses. The answer is aneurysm rupture. 4. Which of the following blood vessel layers may be damaged in a client with an aneurysm? A. Externa. B. Interna. C. Media. D. Interna and media. The answer is media. 5. When assessing a client for an abdominal aortic aneurysm, which area of the abdomen is most commonly palpated? A. Right upper quadrant. B. Directly over the umbilicus. C. Middle lower abdomen to the left of the midline. D. Midline lower abdomen to the right of the midline. The answer is middle lower abdomen to the left of the midline. 6. Which of the following conditions is linked to more than 50% of clients with abdominal aortic aneurysms? A. DM. B. HPN. C. PVD. D. Syphilis. The answer is HPN. 7. Which of the following sounds is distinctly heard on auscultation over the abdominal region of an abdominal aortic aneurysm client? A. Bruit. B. Crackles. C. Dullness. D. Friction rubs. The answer is bruit. 8. Which of the following groups of symptoms indicated a ruptured abdominal aneurysm? A. Lower back pain, increased BP, decreased RBC, increased WBC. B. Severe lower back pain, decreased BP, decreased RBC, increased WBC. C. Severe lower back pain, decreased BP, decreased RBC, decreased WBC. D. Intermittent lower back pain, decreased BP, decreased RBC, increased WBC. The answer is severe lower back pain, decreased BP, decreased RBC, increased WBC. 9. Which of the following complications of an abdominal aortic repair is indicated by detection of a hematoma in the perineal area? A. Hernia. B. Stage 1 pressure ulcer. C. Retroperitoneal rupture at the repair site. D. Rapid expansion of the aneurysm. The answer is retroperitoneal rupture at the repair site. 10. Which hereditary disease is most closely linked to aneurysm? A. Cystic fibrosis. B. Lupus erythematosus. C. Marfan's syndrome. D. Myocardial infarction. The answer is Marfan's syndrome. 11. Which of the following treatments is the definitive one for a ruptured aneurysm? A. Antihypertensive medication administration. B. Aortogram. C. Beta-adrenergic blocker administration. D. Surgical intervention. The answer is surgical intervention. 12. Which of the following heart muscle diseases is unrelated to other cardiovascular disease? A. Cardiomyopathy. B. Coronary artery disease. C. Myocardial infarction. D. Pericardial effusion. The answer is cardiomyopathy. 13. Which of the following types of cardiomyopathy can be associated with childbirth? A. Dilated. B. Hypertrophic. C. Myocarditis. D. Restrictive. The answer is restrictive. 14. Septal involvement occurs in which type of cardiomyopathy? A. Congestive. B. Dilated. C. Hypertrophic. D. Restrictive. The answer is congestive. 15. Which of the following recurring conditions most commonly occurs in clients with cardiomyopathy? A. Heart failure. B. DM. C. MI. D. Pericardial effusion. The answer is heart failure. 16. What is the term used to describe an enlargement of the heart muscle? A. Cardiomegaly. B. Cardiomyopathy. C. Myocarditis. D. Pericarditis. The answer is myocarditis. 17. Dyspnea, cough, expectoration, weakness, and edema are classic signs and symptoms of which of the following conditions? A. Pericarditis. B. Hypertension. C. Obliterative. D. Restrictive. The answer is restrictive. 18. Which of the following cardiac conditions does a fourth heart sound S4 indicate? A. Dilated aorta. B. Normally functioning heart. C. Decreased myocardial contractility. D. Failure of the ventricle to eject all the blood during systole. The answer is failure of the ventricle to eject all the blood during systole. 19. Which of the following classes of drugs is most widely used in the treatment of cardiomyopathy? A. Antihypertensive. B. Beta-adrenergic blockers. C. Calcium channel blockers. D. Nitrates. The answer is beta-adrenergic blockers. 20. Which of the following is the most common symptom of myocardial infarction? A. Chest pain. B. Dyspnea. C. Edema. D. Palpitations. The answer is chest pain. 21. When do coronary arteries primarily receive blood flow? A. During inspiration. B. During diastole. C. During expiration. D. During systole. The answer is during diastole. 22. Which of the following illnesses is the leading cause of death in the US? A. Cancer. B. Coronary artery disease. C. Liver failure. D. Renal failure. The answer is coronary artery disease. 23. Which of the following conditions most commonly results in CAD? A. Atherosclerosis. B. DM. C. MI. D. Renal failure. The answer is atherosclerosis. 24. Atherosclerosis impedes coronary blood flow by which of the following mechanisms? A. Plaques obstruct the vein. B. Plaques obstruct the artery. C. Blood clots form outside the vessel wall. D. Hardened vessels dilate to allow the blood to flow through. The answer is plaques obstruct the artery. 25. Which of the following risk factors for coronary artery disease cannot be corrected? A. Cigarette smoking. B. DM. C. Heredity. D. HPN. The answer is heredity.